Hi, I'm Michelle Grzoulis, and I'm president of the foundations at Rochester Regional Health, and I'm here today and joined by Dr. Krista Damann, who is a neuropsychologist at Rochester Regional Health. Happy to have you here today.
Yes, thanks for having me.
So the topic for today's discussion is concussions and all that we're doing as a health system to support concussions and taking care of our patients that have concussions. As always, I want to ask all of you, if you have questions, to write them in, and we'll attempt to get them answered while we're talking. So I always like to start with this question. Well, I like to start with, why did you go into what you went into as a field?
Sure.
And describe for everybody, what is a neuropsychologist?
Of course. A neuropsychologist has a doctorate in psychology, and then they do a 2-year postdoctoral fellowship to learn more about neuropathology, how the brain works, neuroanatomy, and so we're really experts in brain behavior functioning. So a lot of what I do is I provide assessments for individuals who have concerns about cognitive functioning, so changes in memory, attention, and also behavioral changes or emotional changes that can accompany injury to the brain, like a stroke or a traumatic brain injury, or in this case, a concussion.
Yeah, which we're going to talk about in a little bit.
Yes.
Okay, so let's start, because we are in the season of football, and I know that that's one of the primary drivers of concussions, but not the only. So let's talk about what happens with a concussion. Let's start at the baseline. So describe for everybody, what is a concussion and what happens in your brain?
Sure. Concussion typically involves a blow to the head or sufficient force to the head. So you don't even have to hit your head. It can be blunt force, like for example, hitting the head with a baseball bat. You can have a fall where you hit your head. Or, for example, a motor vehicle accident where you sustain a whiplash injury where you don't actually hit your head, but there's sufficient force. And so we know that there are biomechanical forces that cause a cascade of events or neuropathological changes in the brain. And that oftentimes includes release of neurotransmitters, shifts of ions, changes in glucose metabolism. So we can get really scientific about it, but basically there are transient changes to the brain that happen if there's sufficient force to the head.
So it's not always necessarily like we think, well, I think your brain's encased in your skull. And so is it really about the brain hitting the skull, or it could just not even, it's just the trauma that happens?
Well, the nice thing, so the skull is like our helmet, which is a nice protector for our brain, but we also have something called cerebrospinal fluid, which is like a shock absorber. So a lot of times our brain isn't actually even hitting against our skull with a concussion. If it does, we're more likely to have a bleed or a hemorrhage in our brain, and that's a more significant or can be a severe brain injury.
Okay. So let's talk about just the symptoms of concussion or acute concussion. Like, what are things that people should be looking for if somebody they care about seems to say, I think I hit my head?
Yeah, so first we're looking for sufficient force, and I like to boil that down to really realistic everyday terms. So we found that between 80 to 100 gravitational force, or G-force, is that threshold where we might have a concussion, and that's the equivalent of driving your car 25 miles an hour and running into a brick wall and hitting your head on the dashboard.
Wow.
Okay, so if you're looking at your loved one playing a sport or having a fall, you kind of want to see how bad was the force that they had their injury. Second, we're also looking for alteration of consciousness, where people don't necessarily have to lose consciousness to have a concussion, but they can be kind of foggy, dazed, slow to answer questions, just not seem like themselves. Yeah. And then there's some other physical symptoms we often see for concussion, headache being a primary one. Sometimes we have dizziness, nausea, vomiting, sensitivity to noise and light, where they're just almost intolerant. Yep, more tired. And there can be some cognitive changes early on in acute concussion where people will be just more difficulty focusing, short-term memory loss. And that can be alarming for folks when they don't remember something that happened the day before.
Yeah. Does it matter where you hit your head? Like what part of your head gets hit?
Not exactly. Some of the studies suggest that there's maybe a lower threshold, helmet studies for football, when you're hitting in the face mask. But otherwise, it doesn't matter exactly where, but what does matter if there are rotational factors. Okay, so if your head is kind of twisted or jostled around more than just a front and back injury, that tends to be associated with a worse concussion or a worse injury.
Okay. So how do you diagnose a concussion? What should somebody do if they think that hit that they took was hard enough, or they're having some of those symptoms?
We're always encouraging people to seek medical attention and treat it that way. There are a lot of people that self-diagnose concussions these days because there's just more awareness, but that can be problematic when there's misinformation. The other thing is by going to your doctor, going to the hospital, they might choose to do a CT scan just to make sure there's no bleeding in your brain to rule out, a more severe injury exists or doesn't exist. And then that helps us to provide education and recommendations for someone early on. We really believe early intervention is helpful for treating concussions, and that's definitely our philosophy at Rochester Regional.
So we're going to talk about Rochester Regional
Sure.
in a second, but talk about, so you just mentioned, early intervention for treatment.
Yes.
But what are the treatment protocols for concussion?
So after that diagnosis happens, we typically recommend reduced activity level for a period of several days, sometimes weeks, depending on the symptoms. So that generally means, no work, no school, no exercise. If this is a sports injury, there's return to play protocols that are enforced, because we want to prevent people from re-injury. But after that, we should see a slow improvement of symptoms, and if we don't, or if the symptoms are very severe, we might consider prescribing certain medications to treat symptoms like headache or sleep disturbance. But we really would like to see that natural healing process. I said before, those changes, the physiology, those changes are transient and they start to reverse on their own. And that's why the prognosis generally is very good for concussion.
Okay.
So we kind of wait it out in the beginning.
And watch.
But we don't want prolonged rest. And that was something we used to prescribe a long time ago, where students might have been out of school for months or out of work for months. And we found that's actually contraindicated. It can lead to poor outcomes when people stay out of life or out of sport for too long.
And don't work their brain in some of the same ways.
Yeah, so we try to, as tolerated, get them back to that normal activity level.
So before we jump into some of the cognitive effects and depression, anxiety, I want to jump back up to, I think, the age-old question for parents today who have kids who want to play contact sports: is it safe?
Yes.
And I know that's a tough one to answer, but
Put me on the spot. I'll take it.
I'm sure someone's going to ask it. I don't know if they already have, Phil, but
This is a great question, and we've had some recent research studies come out in the past year or so that are starting to link repetitive head trauma with poor outcomes, okay, so a longer, prolonged kind of recovery process, but also increases risk of re-injury. Once you have a concussion and you go back, to example, to play football, you might be more likely to sustain another concussion because you might have changes in balance, changes in awareness. But there is this looming question of something called CTE, or chronic traumatic encephalopathy. And so many people became familiar with this concept from watching the Concussion movie with Will Smith that came out a little while ago. And so the bottom line is that the science is still in its infancy with understanding CTE and understanding, even agreeing upon what the pathology is in the brain beyond. We know that there's tau proteins, but there's just so much that we don't know. So it raises these questions and red flags. Is it safe to allow our kids to play football or hockey or MMA, other really contact sports? I always tell parents that that's a personal decision, and I encourage them to be informed, but also intentional in making that decision. You kind of have to look at the big picture, and I think it's parents' jobs to protect their children and to look at life beyond sport for their kids, because most kids think they're invincible. They're just in the here and now, and they're not necessarily looking at the big picture.
yeah, it's true, and it's good advice. I mean, I think it's hard. There's probably not one perfect approach for any individual student or parent or...
No. One of the issues is sometimes you might know your child is one who's not going to report symptoms and is going to be at more risk of getting more concussions. And that might be a parent who decides to be more conservative with letting their child play and maybe encourage them to play non-contact sports.
Yeah. So before we jump off of that, though, I do want to talk about, there is research, though, that supports that long-term exposure to repeated sort of trauma to the head does have some cognitive learning issues, and high school students from a developmental perspective might be at risk for that. So talk a little bit about that.
Yeah, I mean, I think we're going to see some changes over time, and maybe when we allow kids to start playing certain contact sports, we might want to end up delaying that later. And there might even be legislation, perhaps on the state level at some point, that addresses that. Just from a common sense perspective, most of us have a brain and we think, that just can't be good, right? To keep hitting your head over and over again, like, what good is going to come of that? If anything, it's potentially a bad thing. So I think just sometimes that common sense perspective can even supersede what the science is suggesting at the time. But certainly when student athletes sustain a concussion and they're out of sport, they're also usually out of school.
Yeah.
And so that can be really tough. They're falling behind in school. For serious students, that can be very anxiety provoking. They're also missing out on socialization, which is really important during that developmental age period, when they're supposed to be resting. And so there's a number of implications from sustaining a concussion just in terms of how that changes, the psychosocial environment that a student is in.
Yeah. So I want to shift, not really shift, but I want to talk a little bit about some of the things that I think is where your line of work comes in when you talk about anxiety or depression being a result of brain or concussion.
Yeah.
So talk a little bit about that.
Yeah, that's a great question. I love answering this question as a psychologist by training. So sometimes there are just changes in the brain. There are certain areas of the brain where we know more of our emotions or our emotional control is stored, and sometimes there's theories that that part of the brain could be disrupted. What I tend to see more is that this is a situational stress, right? So, no one likes not feeling well for days in a row, and kind of, if someone's really active, to all of a sudden have your life put on hold, that's stressful. And so some people cope better than others with that. And so the people who have trouble coping are more likely to develop anxiety, am I gonna get better? Sorts of anxiety, feeling low moods, and so if someone used to cope by exercising and now can't do that for a time period, that can be stressful for folks. There's also a group of people who had premorbid anxiety, depression, or other mental health conditions, then sustain a concussion. And those individuals, their conditions are exacerbated or made a lot worse by having that concussion.
And define what you mean by premorbid for people listening.
Yeah, sorry. So people who had anxiety or depression.
What non-clinical people understand.
Right. So people who had those conditions before they ever had a concussion. They were already present, either had been diagnosed or maybe they had some of the symptoms before the injury.
So it's the compelling event that brings it out.
Yes, or they're already being treated for that and then they have this injury and now it's just kind of worse.
Okay.
And they're just not coping with it very well.
I'm going to pause for a second and check with Phil to see if we have any questions.
Can you talk about rushing back from a concussion, people want to get back to their sport as soon as they can get there? Just talk about what could happen or why it's important to sit out the appropriate time.
Yeah, that's a great question. So I think really some of this was sparked from something called second impact syndrome, where someone, it's a very rare condition where someone has an injury and then does not, they continue to play and then they have a very dangerous injury that could end up causing someone to die. Very rare that we see the second impact syndrome. It's really more looking at return to play and trying to be safe and trying to prevent individuals from having repeated concussions, right? Because we kind of talked about already, you are more vulnerable to having a concussion once you've already had one. And so we really, the rule of thumb is we like people to be asymptomatic. So we want their headache to improve, their sleep to be regulated, no more difficulties with focus and concentration. And that's why we do a lot of these impact testing where we have baseline screens cognitively on student athletes, and then we'll reevaluate them to make sure that they're recovering over time appropriately. Unfortunately, there are a lot of ways that student athletes get around those things. They fudge the baseline where they purposely don't do as well as they could in case they have a concussion. And so then that way it'll be easier to pass later on.
Oh God, I hadn't even thought about that.
Yeah, that happens all too commonly, and we also have students who don't even report symptoms of the concussion to their athletic trainer or their coach or their parents, and they just keep playing their sport.
It's the invincibility. It's the perceived invincibility of kids, and it's so hard.
And they're just team players. They love the sport, and they don't want to let their teammates down.
It's hard. My kids are like that.
And there's that tough nature, particularly contact sports. You're supposed to be tough. It's a whole part of what you're doing. So it is hard for students to come forward. I have to say I've been evaluating a number of college students recently, college football players, who have been in this very same predicament. And it's heartbreaking because some of them have had to give up their sport in the middle of their college career and are struggling to not get kicked out of school because their grades are really poor. And they're having all of these symptoms and they're just filled with regret from not reporting it sooner and going out of play and following the protocols that are meant to help.
It's hard. I mean, it's really hard, and you can empathize. So I want to talk about, so I would assume that part of what the study, what you do in your profession is that there are people who come through the treatment and they're good, but then there's still some lingering psychological impact that you end up stepping in as a psychologist to say, so what's your advice for parents who have kids who have had a concussion and who, from a physical perspective, symptoms are gone, so they seem to be good, but yet there's kind of this latent, hey, they're not the same person they were before. What should parents do?
Great question. I think that's a time where usually the first line of defense, if they're not already connected with our concussion program, would be to go to the pediatrician. And to share that they're noticing concerns that seem to happen or be lingering from the concussion, and ask if they could be evaluated by a neuropsychologist or a concussion specialist at that point. We have really nice tools to assess, thinking skills, so attention, concentration, memory, and also aspects of emotional functioning. And there are objective measures that we can use to really get a sense of what's going on with that particular child. And then make recommendations for treatment.
So, I'm not sure if I'll ask this right, but I'm curious. So, let's say a child who had a concussion seems to be exhibiting more anxiety. And, if they were a child that hadn't had a concussion, had anxiety, you'd go to a therapist, and the therapist or psychologist would say, here's sort of the way that you cope with therapy or with the anxiety. Is because it came from a concussion is the protocol for treating different because the anxiety was manifested as a result of a concussion? Does that make sense?
Yeah, that absolutely makes sense. Not necessarily. We would generally prescribe the same sorts of medications if medication is indicated for more severe cases. And we would use the same sorts of therapies. Typically something called cognitive behavioral therapy is one of those well-known and tried and true sorts of therapies we think of for anxiety or depression. Sometimes we do see people have mood changes that are more characterized by irritability, poor control over anger and impulses, and that is very concerning when parents see that in their children or see that in themselves. And almost always they come in and they really want to know, okay, this seems more concussion related because this is...
It didn't happen before.
Yes.
Yeah, okay. So I want to just kind of summarize a little bit before we jump into, so what is RRH doing as it relates to concussions, because that's really exciting. So what I've taken away so far from our discussion is that it's important for people to look for the symptoms that somebody might have had some kind of concussion of some sort, and see a pediatrician or your primary care physician to get potentially referred, but that there are ways to not only treat the physical symptoms but also the psychological impact of what the concussion might have caused.
Absolutely. Great.
Okay, good.
You could do my job.
No, I can't. Trust me. No, I can't. So what I want to talk about now is Rochester Regional Health, because I'm really proud of, and I know you are too, some of the things that we're doing in the concussion space. So talk a little bit about our concussion program.
Yes. Our program is unique in this Rochester area because we don't just service people who've had sports-related concussions. Okay, so we're also addressing people who've had motor vehicle accidents. You had it's Rochester, winter time, slip on your ice. A lot of people do that, work injuries. It doesn't matter how you sustain the injury. We're experts and specialists in being able to treat that. And so we have a really nice team of physicians. We have sports medicine physicians. We have physiatrists, which are physical medicine rehab doctors. We also have neurologists. A team of neuropsychologists. We also have some really great physical therapists, many of whom are specialized in vestibular therapy, which does great things for people who are symptomatic from concussion.
I have that myself.
Yeah, so we collaborate as a team, we work together, we pick up the phone and talk to each other. We really care about treating the patients as a whole person. And as a team, I think we do a great job.
It's a very collaborative model of care.
Absolutely.
Very collaborative. Let me stop and ask Phil, no other questions come in. So let me just ask you if there's anything that I haven't asked that you think, oh wow, I really want to tell the listeners this as it relates to either our programs or advice.
I think it's just important to be informed and to be a critical kind of consumer when it comes to research or headlines that you might read. I oftentimes see people come into my office and are very misinformed about concussion. Are very anxious that they already have dementia or CTE. And so knowledge is power, but if it's misinformation, it actually works against us. So kind of looking more with a critical eye when we're looking at, because sometimes the media can blow things out of proportion because it's a really great story and people are going to read it. Like for example, last year, the Journal of American Medicine kind of published about CTE, NFL players. And it said like 99% of NFL players had CTE, but what it kind of failed to really highlight, unless you did read the fine print, was these were people who donated their brains, so they already suspected they had the symptoms of CTE, and it really told us nothing about the prevalence of the disease itself.
In living individuals.
Yes.
Yeah.
And so it just told us, though, people who thought they had the symptoms were pretty good at predicting that before they died, right?
Yeah.
So it doesn't, but, you know, the study can be easily misquoted and make us think that, wow, like, you know, all NFL players are going to have it. And the other thing is we can't generalize elite athletes to maybe our kid
I know.
who plays a few years of sports, you know, and doesn't have near the number of concussions that you know, an elite athlete might have.
Well, it's really helpful, and I appreciate you
Yeah.
sharing it with us
Sure.
because I think it's one of those things that you can't necessarily see inside your brain. So
Yes.
it's not like looking at your arm and seeing a cut or a bruise. And so
Yes.
relying on the experts to help us is always I think the best
Yes.
advice. So I want to thank Dr. Krista Damann for being here today. As I said before, Krista is a neuropsychologist at Rochester Regional Health, and really appreciate you spending some time with
Yes.
us. So thank you very much.
Thank you.
Nice job.
Okay, good.
Yeah.
I started sweating partway
Yeah,
through.
well,